All right, good evening everyone. So how was biochemistry? I guess it was all about vitamins and inborn error of metabolism in biochemistry, right? So the star of the show was vitamins and inborn error of metabolisms. So even if you see the 3-day notes in biochemistry, in all the 3 days we cover vitamins somewhere or the other. And even the metabolism, we have last minute revision topics. It is always there that we have LMR topics of sphingolipidosis, all the lysosomal storage diseases, and glycogen storage diseases. I always say that it is my last minute revision topics. So what did you find? Also, the most commonly covered topics under all the 3 days is vitamins, and I always say that during the 3-day session that you will find alcoholic in the examination, you will find insulin somewhere or the other in the examination, and you will find vitamins as well as the lysosomal storage diseases, right? So those are our topics. So what were the questions? From vitamins, some of the recall questions which I could see was, it was on vitamin B7, which is also vitamin H, and it is biotin deficiency, which is seen as alopecia. Right, there was alopecia given. Then what else? What was the question on the vitamin B7? The complete question. Another question was on vitamin B3, and I guess there was question on vitamin B1 also, which was related to Wernicke-Korsakoff psychosis. We always refer to it as, in the class also, we always refer to it as the Goa. That was the mnemonic which we have used. Global confusion, ophthalmoplegia and ataxia. And yes, vitamin B7 deficiency is associated with avidin, because avidin binds to biotin. It binds biotin. And the alopecia, I guess that was in the question was a child with thinning of hair and patchy loss of hair. So something related to hair, it has to be biotin. And this we have seen under several times, even under propionyl CoA carboxylase deficiency. This is a repeat question since so many years, last 3 to 4 years, we are seeing questions on carboxylases related to vitamin B7 deficiency, acetyl-CoA carboxylase and pyruvate carboxylase. Pyruvate carboxylase. As far as question related to vitamin B1 is concerned, it was related to eating polished rice, right? And yes, there was a question on uric acid also, right? That we will discuss once we have covered the questions on vitamins. How many questions were there on vitamins? The star of the show, yes. And the question on eating polished rice, a village with rice and pulse as staple food diet. Now the people develop muscle stiffness. So it is neuropathy developed because of vitamin B1 deficiency. Then what vitamins can be given to other family members to prevent this? Of course, it will be vitamin B1. And somebody is saying entire paper was on vitamins. All right, good news. For those who were studying DVT sessions, right? It was all there on that sessions also. Then yes, even if it is not polished rice, it will be, they want to refer it to that only, right? The rice and pulses is a hint only to tell you that it will be due to that polished rice only. Yes, what else? Which vitamin, other vitamin can you remember? There was a question on vitamin K as well. The fat soluble vitamin K, factor 2, 7, 9 and 10. And I always write it like this so that you are able to remember that this is easier way to remember the clotting factors which are vitamin K affected. Yes. Then any other recall from vitamins? Niacin. What about niacin? Vitamin B3. Something regarding pellagra. Something regarding the 4 Ds, diarrhea, dermatitis, dementia. Yes. Yes, there were 4 Ds as well. Diarrhea, dementia, dermatitis, death, and that is due to niacin deficiency. What else did you see? Okay, out of the 4D, 3 Ds were mentioned. Right, good. Thanks for correcting. 3 Ds were mentioned in the examination. What else could you see? Which other vitamin? Yes, of course, death was not given, because then how will they make the question, right? The patient died, the question also died. All right, which other vitamin were there? I guess A was not there. There was vitamin C on the examination. There was vitamin D. Can you recall the question related to vitamin C and D? Which was related to vitamin C and D? Okay, bow legs. of vitamin D deficiency. Classical, we always show in the examination in the DVT session the bow legs X-ray. Collagen synthesis for vitamin C. Impaired collagen synthesis for vitamin C. The enzyme is prolyl hydroxylase. Yes, resulting in poor wound healing and of course scurvy. Was prolyl hydroxylase in the options, or the options were consisting of vitamin A, B, C, D? Good. Somebody remembered another question on vitamin B1, that is RBC requires transketolase, and this enzyme transketolase requires vitamin B1. Alright. Then this prolyl hydroxylase requires iron. It requires iron. And RBC is transketolase. RBC is transketolase. It requires thiamine, vitamin B1. Rather, we use a test known as erythrocyte transketolase activity to assess somebody's vitamin B1 status. So that was a good question. Everything is there in notes, no doubt. And any other vitamin you can recall? Anything about B9, B12, folic acid or cobalamin? Okay, there was a question on minerals. That was zinc, noted. And the options, the question was related to its, basically it causes acrodermatitis. Zinc deficiency is resulting in acrodermatitis enteropathica. So mineral zinc deficiency, you can see a rash because it is classical dermatitis which is around eyes and mouth, right? So that can be. There was a question on B12 deficiency, subacute combined disorder. Yes, it is affecting both posterior as well as lateral column. That is unique to B12 deficiency. This is not seen with vitamin B9 deficiency. Alright. So, is it related to only B12 deficiency, or there was some other intrinsic factor in the options, or B9 in the options? Can you recollect some options for this subacute combined degeneration? Let's see. See the B12, the enzyme which is B12 is associated is 2. You have methyl malonyl CoA mutase. Was that in the option? Methyl malonyl CoA mutase and homocysteine methyl transferase. Homocysteine methyl transferase. Alright. So we have some hint here. There was the symptoms of subacute combined degeneration that is affecting both the dorsal as well as lateral column. So it will result in the loss of vibration, temperature, right? Those kind of senses. Alright, so here only diagnosis was asked, so your answer will be vitamin B12. Anybody who has not marked vitamin B12 on subacute combined degeneration? Anybody missed it? I don't think so. This was a clear answer there. So this was not there. Clinical features were given for subacute combined degeneration. Alright. Okay, got it. So yes, there was palsy associated with it. Perfect. So, and there was sensory defect affecting the motor paralysis. Fine. So that is because of the vitamin B12. Okay. There was some other question related to L-captonuria, coming to inborn errors of metabolism. We have inborn errors of metabolism. Number 1 was L-captonuria. Any other disorder you can think of? Any other inborn errors of metabolism? I guess blackening of urine was a clear giveaway. Was it mentioned anywhere benzoquinone or homogeneticic acid? Blackening of urine or cartilage, which is also known as ochronosis. So, okay. So the question clearly said it is blackening of urine. That was mentioned. Alright. So it was not ochronosis. Alright. Good. Fair enough. So I guess you have answered L-captonuria also. It was clearly, simply, easy to answer L-captonuria. Right? There was a glycogen storage disease. It was, there is no glycogen accumulation, as I can see from the chat box. No glycogen accumulation. On liver. Severe hypoglycemia. But I'll need something else here. I'll need some more information here. What were the options? What were the complete question? Was this related to McArdle's, or it was because it looks like McArdle's, because there is no glycogen accumulation and somebody has mentioned that it is in the liver. So liver glycogen, that means, is normal. But why is it McArdle's? Probably there were 2 questions on glycogen storage disease. One related to severe hypoglycemia and another was McArdle's. Right? So there were 2 questions. Yes. So okay. There can be, one can be McArdle's disease. For the other question, I'll need something more information here. McArdle's will be muscle phosphorylase deficiency. The enzyme was asked. It is muscle glycogen phosphorylase deficiency. What about the other question? Was it Cory's phosphorylase? Yes, I guess the other question was Cory's. Right, Cory's has a similar presentation. And here the enzyme, if it is asked, I always say it is A, B, C, D. Anderson's has branching defect, Cory's have D branching defect, and therefore presenting with hypoglycemia. Alright, so there will be D branching defect. If this is the complete question. Alright. And there was questions on Tay-Sachs and Gaucher's. Yes, this is one of the famous slides which I always use, and that concludes your Tay-Sachs and Gaucher's. Everything here. It is hexosaminidase A deficiency, Tay-Sachs, glucocerebrosidase, onion skin lysosomes, Gaucher cell. There is asked is The cherry red spot is seen in two. One you will find it in Niemann-Pick and another you will find it in Tay-Sachs. And there is cherry red spot. We will give it away with, but there if they have mentioned there is no hepatosplenomegaly, then it is Tay-Sachs. Because for Niemann-Picks, there is hepatosplenomegaly. There is hepatosplenomegaly. Alright? Then, both were asked. Alright. So I guess both were asked. Crumpled tissue appearance was asked for Gaucher's. Fine. So we have crumpled tissue appearance for Gaucher's. The enzyme here, what about the enzyme? What was the enzyme defect asked? For Gaucher's picture came, it was image based. Alright, so it will be crumpled tissue paper appearance. So that means no hepatosplenomegaly and cherry red spot. So we will go away with Tay-Sachs. Alright. So they asked what was the enzyme accumulating, and for Gaucher's I get what was the accumulating metabolite, and that will be glucosyl ceramide. Glucosyl ceramide. Right? So good. It was a good recall session. Anything else you can recollect? A lot of questions from biochemistry. That makes me very happy, and I hope that makes you also very happy, because the questions were very easy. Right? And this is from the all these questions are from the notes, all from the DVT sessions we have revised. So yes, it was very easy. And yes, there was a question on uric acid. There was a question on uric acid. What was the question? Was the drug allopurinol asked? Allopurinol? And there was a question on allopurinol is a suicide enzyme inhibition. It inhibits the enzyme xanthine oxidase. The inhibitor was asked or the treatment was asked? Again, alcoholic. Yes, good. I always say koi na koi alcoholic sharabi zarur milega in the examination. So yes, you saw so many today. And which drug stops the uric acid synthesis? Alright. Which drug inhibits uric acid synthesis? Fine. Fair enough. Okay, uricosuric. Uricosuric drug or allopurinol? What was the answer? What were the options? If the synthesis inhibitor is asked, then the answer is allopurinol. No history of trauma. Okay. No history of trauma. Phalangeal, first metatarsophalangeal. First metatarsophalangeal joint involvement. Joint involvement. Allopurinol, colchicine, probenecid, all of these are for gout. But yes, because the synthesis is getting affected, great toe is involved here. Okay, that was there in the options. So then the answer will be allopurinol only. Alright. Then, okay, there were two questions on uric acid. One is drug related question. Okay, get it. I get that. So there are two questions related to uric acid alone. Alright, purine metabolism. Fine. Alright. So there was an alcoholic gouty arthritis. Uric acid lactate levels are high. Urate and urea are elevated. NADH to NAD ratio is low. Somebody is saying 3 questions on uric acid. What were the 3 questions? Please tell me then. Okay, the second was alcoholic patient. But what was asked? There is alcoholic patient, fine. Acute gout versus pseudo gout. Just 1 second. There is acute gout versus pseudo gout. Now that is somewhere here only we have written uric acid. Yes. Acute and pseudo gout. What were the options for this? Normal uric acid in serum was acute gout. See, uric acid can be normal, it can be high, it can be low at the time of acute gouty arthritis. Rather, an abrupt fall or a decrease is a more common cause of acute gout. Right? So, that is due to, there has to be here, if you see monosodium urate crystals, then I can say it is acute gout. And for pseudo gout, it is positively birefringent. For acute gout, it is negatively birefringent monosodium urate crystals. And for pseudo gout, it is positively birefringent urate crystals. These are not monosodium urate. No crystal seen. No crystal seen. Okay. No trauma mentioned. Alright. No trauma, no crystals. So that was another question. Alright. Yes, it can be reactive arthritis. One of the options can be reactive arthritis. They could have mentioned here in the options, I guess that was mentioned was there was gout, there was pseudo gout, and there was rheumatic arthritis in the options. Okay. Okay. And there was some other question also related to NADH. There was an alcoholic whose NADH to NAD is low or high. I guess it should be higher in the question. Blood urea, I don't know what was mentioned, and blood uric acid. What will happen to blood uric acid? The blood uric acid will tend to be higher, but I guess NADH to NAD ratio should be more, because the metabolism is such that whenever alcohol gets metabolized, its NADH concentration in our body that increases. So it should be there in the question, right? Uric acid, as well as if there was lactate in the question, and there will be increase in lactic acid. There will be increase in lactic acid as well, right? Yes, both will be increased. Both will be increased. All right. So fair enough. I guess you enjoyed the session as well as. Now this will happen throughout today. You will keep on facing one or the other question will keep on coming in front of your eyes. Right? ना ही वो सोने देगा, ना ही वो चैन से जीने देगा आज के लिए. But yes, all good. Right? So there will be some of the things I guess you might have already, these were quite easy questions, right? There can be one or two questions here and there wrong, but yes, by and large, I know you people have found biochemistry quite easy, right? Alright, thank you so much. See you once you have cleared your PG entrance.